So congratulate Schmidt and Cartwright. Tina Cartwright is my friend and colleague and well-known yoga researcher for their newly published paper, which is Recommending Yoga for Health, a survey of perceptions among healthcare practitioners in the UK. So this is a really important piece because actually, if we want to understand how yoga can be more integrated into healthcare, we need to know what are the variables that lead to more recommendation of yoga or prescription, although there aren't really a lot of prescription pathways minus social prescribing. And obviously we need to be able to influence policy. People that want yoga on the NHS that are patients need to also attempt to lobby for that. But in the middle of both of these are these health practitioners who have a lot of clout, especially as they band together. So in this survey, we had 198 health practitioners who responded. They're definitely self-selected, so it's not surprising that a lot of them are going to practice yoga. In fact, 68% reported having practiced yoga in the last month. It would be great if somebody else wanted to do like an even bigger study with the Royal College of GPs. Any researchers out there looking at what old GPs, for example, think about recommending and prescribing yoga. Right? But here, it's important to note that the biggest predictor that we see in the recommendation or prescription of yoga is that a health provider themselves has experienced it, right? We know yoga is quite transformative, and if somebody goes to a number of classes, often they feel the benefits and they think, okay, one, I think it works, and two, I believe it's going to be safe for my patients. That's a big thing, by the way. Now, in terms of the conditions for which healthcare providers felt most comfortable recommending yoga to patients, with mental health, 92% said they were willing to recommend that. That's huge. And that's down to probably a bunch of factors. One, the research evidence for yoga's efficacy in mental health conditions, specifically for stress reduction, anxiety reduction, and mood improvement, including depression, is higher than any other health condition. The other is there's just more research within that area. And I guess there's been a lot of movements and campaigns to focus on yoga's value for mental health, as well as patients reporting that back to their healthcare providers. The second most common condition was musculoskeletal. That was 84%. And more often than not, that's going to be for lower back pain, an area for which we also have good quality and a good amount of research on. So research is key, as well as the actual practice of the healthcare providers. Now, given the practice for healthcare providers is so important, if you can go into a clinic, a surgery, a hospital, and say, I'd like to offer 4 free yoga classes. I know cost of living can be challenging, but if you can, right? I'd like to offer 4 free yoga classes for your staff. You might make a really big difference. And sometimes you might end up being hired because once you practice yoga, it's like, how can you live without it? In terms of obstacles, healthcare providers said they need more information regarding the clarity of what kinds of practices are going to be useful and or contraindicated for certain health populations, and also the fact that yoga can be expensive. So it's about offering concessionary rates and or, once again, yoga being available on the NHS, or potentially it could be accessed freely. In Yoga for Health, where yoga is part of social prescribing, a 10-week program created by the Yoga for Health Alliance is often offered for free or very inexpensively for patients. And they can look that up. Maybe you have somebody you want to recommend on www.yogainhealthcarealliance.com. Anyway, read this paper. It's freely available. It's super cool. Share it with everyone you know, including health providers. Namaste.